Hey everybody, welcome back to my channel. Be sure to hit that subscribe button, hit the like button, comment, and share the video. Got an article today from Data Breach Today. It says Feds warn healthcare sector of web application attacks. HHS, HC3 advises medical centers others to mitigate risk involving many common apps. Federal authorities are advising healthcare sector entities to batten down their patient portals and other common web applications from cyber attacks. I used to work for a healthcare organization. They did have a patient portal. And basically, the patient portal makes it easy to communicate with their physician or for the patients to check various different kinds of things like medical records, test results, schedule appointments, etc., etc. Explains that here, more popular over the past decade. Access to medical records, test results, blah, blah, blah. Let's see here. Downside is that many of the healthcare sector's most notable cyber attacks include ransomware and distributed denial of service attacks have affected or involved web apps as a vector. Of course, web apps are going to be a hole into the organization. If you're not properly implementing security best practices, making sure your code and your servers are up to date, everything that's supporting that web portal is up to date, all the components are up to date, then it's going to leave us a big hole for attackers to get into your organization and then hit you with some kind of malware or steal some kind of data from you. See, Department of Health and Human Services, Health Sector Cybersecurity Coordination Center advisory issued on Thursday warns that hackers often leverage stolen credentials or exploit a known vulnerability in attacks involving healthcare web applications. Now, if you ever worked for a healthcare organization, you'll come to find out there's a lot of red tape in trying to get things done. So anything that comes up that's like, hey, critical, this needs to get fixed, or that needs to get fixed or replaced, what have you, and there's certain parties or individuals that don't want to do it, make sure to escalate that to the proper persons, go to the proper chain of commands, blah blah blah, and most importantly, be sure to document all that stuff inside of a risk register or in some kind of email. Save that email somewhere. Make sure you have documentation in case crap hits the fan and the healthcare organization ends up getting breached, because that'll come back in handy when the auditors come by and say, hey, did you do this, that, what and whatnot? Did you inform the correct personnel, etc., etc. Among the most common types of healthcare applications vulnerable to such attacks are patient and health insurance portals, telehealth services, online pharmacies, electronic health records, patient monitoring with IoT devices, webmail, and hospital inventory management. Right, IoT devices stands for Internet of Things, or what I like to call Internet of Trash, because a lot of them are highly unsecure and they're all over the place in these healthcare organizations. A lot of them may or may not be able to be patched or upgraded by the vendor, so you have to come up with different kinds of strategies to mitigate those vulnerabilities or put in place some kind of compensating controls, whether to put those devices in a separate network, quarantine off with or segment it off with like a firewall. And webmail is a big thing as well. You'll come to find out that a lot of these healthcare organizations, the users will never delete emails, or there will be no kind of email retention policy in place that automatically removes those emails from inboxes. And what happens is, a doctor or some other healthcare professional, their accounts gets hacked because they have weak credentials or they're reusing credentials, and the attacker gets in there and starts downloading all kinds of stuff. And a lot of times those emails are containing sensitive information such as medical records, other types of medical information, images, and attackers can sell that information on the dark net. That's why healthcare organizations are prime targets for attackers. Web app attacks. Most recent Verizon data breach investigation report found that web applications were the top attack vector in healthcare, which makes sense if there's a lot of healthcare organizations using those patient portals. And if healthcare organizations aren't taking the appropriate steps to lock those down. Another thing, Verizon data breach investigation report, make sure to check that out. They release some kind of data breach report, I believe, at least once a year, and it's got some pretty good information in there. Basic web app attacks have trended greater over the years. Healthcare sector, more prominent in other industries. Okay. Right. May 2021, ransomware attack on California-based Scripps Healthcare. This is a big organization. I remember seeing this article here. Go ahead and check that out. They got pretty much owned. It was a pretty big ordeal out there. A variety of state-sponsored advanced persistent threats, aka APTs, groups, and financially motivated cybercriminal groups are known to exploit public-facing web applications. Because Russia, Cozy Bear, China. Of course, risk mitigation. Healthcare entities should consider the following here. And these look like security best practices. Let's get into it here. Deploying automated vulnerability scanning and security testing help identify, yep, that's a best practice. Implementing web application firewalls to protect against application security threats, right? This is another best practice. Conducting secure development, SDLC, another security best practice. See how this all comes back to implementing security best practices and implementing and improving upon the security basics. This is pretty much basic stuff. You should be doing this if you're developing applications in-house or what have you. Make sure you're following a good software development lifecycle. Make sure you're including the correct security personnel to check that stuff. Now, you're not going to be able to find everything, but you can make it a lot more secure than just developing something and not even checking for the basic security checks when it comes to um, these kinds of things. That brings up OWASP top 10 security vulnerabilities. They just recently updated their stuff. Go out there and check that out. Look into the Burp Suite and PortSwigger's free Burp uh, Burp security training on their website. Also check out OWASP Zap Tool. It's a free alternative to Burp. Burp does have a free version as well. Just take that into account. Look into these web apps because a lot of organizations are relying on web apps, not just healthcare organizations. Additionally, not all web applications are created equal. Poor software development lifecycle practices are all too common, which leads to insecure applications and exposure of data. See, if they were doing automated web scanning, they probably could have found many of these known vulnerabilities because I've done countless vulnerability scanning, vulnerability management operations such that, and it will come back with, hey, these are critical items, high items, medium, low. You got to dig into that material and then determine if this vulnerability applies, eliminate any types of potential false positives. A lot of times you'll get some pushback on these. Say, hey, I need to fix this critical vulnerability. Get in contact with the business unit and they don't want to do it. So with permission, you can go in and possibly exploit that vulnerability if it doesn't cause any type of downtime in the business. But you can exploit that vulnerability and say, hey, here's proof. This is what I did. I exploited this vulnerability, created this account that has pretty much admin level access. I can do whatever I want here. You might want to get this fixed. That pretty much sums it up. Be sure to check this article. I'll have the link, of course, in the description section below the video. Once again, be sure to subscribe to my channel, hit that like button, share, and comment below on your thoughts. And I will see you later.